Good evening, Peter Goertz. I'm a psychiatrist. This past week, I had an experience that really pushed in front of my face the fact that in Xanax withdrawal and in alcohol withdrawal, people can become psychotic. And it's interesting the way it happened. When I was working as an intern in New Orleans in the Charity Hospital emergency room, one of the staff told me, things come in clusters. One evening can be a stroke night, the next evening can be a heart attack night, etc., etc. And things do at least sometimes seem to come in clusters. So I was at work one morning this past week, and I was asked to see a patient via telepsychiatry, so virtually in an emergency room. And I cover a lot of different emergency rooms via telepsychiatry. So this was one specific emergency room, and this patient sounded like he was potentially withdrawing from alcohol. That was my bottom line assessment after I saw the patient. But his presentation looked like potentially someone who was having an acute schizophrenic psychotic break, very anxious and delusional. And really, even when I talked with him, he was on edge, very anxious appearing. But I spoke with someone who knew him, and I got a little more of a picture, and apparently he'd cut back on alcohol, and he then apparently might have gone into withdrawal from alcohol with psychosis. And what he told me is that he had already cut back previously, but what people say about their use of alcohol and other substances is not always exactly true, of course. So he may not have cut back so much previously, but then right before he came in, during at least a few days before he came into the hospital. So that patient, I thought, needed to be admitted for detox, or at least potential detox, to the medical floor of the hospital and get detoxed with a benzodiazepine, Valium taper potentially, and also get vitamins, of course, thiamine, folate, multivitamins. And so I finished that consult, and then I get called for the next consult, or I call up and ask who's the next consult. And it was in the same emergency room, one of many emergency rooms I cover. And it was a very similar issue. This time a lady who had been having hallucinations, which was not characteristic for her. She had, as far as I remember, no diagnosis of a psychotic disorder. And she told me she was taking Xanax, but not very often, not as much as she was prescribed. But again, people don't necessarily tell the full story, because I looked up the prescribing program document, and she apparently had been filling a good amount of Xanax every month on the dot. So as soon as she could fill the Xanax, she was filling it. So what she was saying as far as not using it very much probably was not entirely true. And then I spoke with someone who knew her, and apparently she had been taking so much Xanax that she had run out of the Xanax at least a few days previously. So overall, my assessment with that patient was that she was in Xanax withdrawal and hallucinating from that. So this patient also, I felt, needed detox, and I suggested that she be detoxed with Klonopin, which, like Xanax, is a high-potency benzodiazepine, but twice as potent as Xanax, so you need about half the dose, which is not really a major issue either way, but it's just the way it is with Klonopin versus Xanax. But also an advantage of the Klonopin is that it lasts a lot longer in the blood, and tapering it down is significantly easier in general than tapering down Xanax. So that's what I suggested for that patient. And it was, in hindsight, very interesting that I saw these patients back to back, same emergency room, similar issue. And again, it reminded me of what that staff member at Charity Hospital had said. Thank you very much.